Hello everyone. Right now I want to present about longitudinal risk trajectory of oral and systemic outcomes in patients with periodontal disease. This is the list of our team member. So first of all, periodontal disease is a common chronic inflammation that weakens the tissues supporting teeth. It mainly occurs due to bacterial infections that disrupt the balance of the oral microbiome, causing damage of periodontal ligament, cementum, and nearby bone structures. So this is the design of our study. Basically, periodontal disease may have recurrence of the periodontal disease and also can cause a long-term outcome and systematic inflammatory stimulus of cardiovascular, neurological, and also metabolic and other diseases. And this study used a Trajectories platform that contained about 11 million patients record from Asia Pacific Healthcare Organization. And the primary objective of this study was to evaluate the cumulative incidence and time-dependent escalation of both oral and systemic stimulus following the periodontal diagnosis. And we define our periodontal disease population using ICD code K05 and use some of exclusion criteria. And we also stratify the population by age and sex to facilitate the subgroup analysis. And for the outcome of our study, we organized into 4 categories. The first is periodontal disease outcome, and then second one is cardiovascular outcomes, and the third one is neurological outcomes, and then we also use the metabolic and other outcomes in our study. And for statistical analysis, we did a cumulative incidence functions, which using the Allen-Johansson method to account for the compounding risk. And risk ratio were calculated by comparing 5-year to 1-year cumulative incidence functions for each outcome, which enabling the temporal risk trajectory quantification. And we also using agentic AI to build an AI literature-based evidence integrations. And this is some of the important findings of our results. And then for the complete results, you can access our interactive web-based result. And this is some of the clinical implication for our study. You can see the some of it based on our results. And here is the QR code, so you can access our interactive web-based result, and you can scan this QR code to access the result of our study with this QR code. And yes, once you scan the QR code, you will be directed to this interface of our web-based AI evidence. And then once you click the Ask Question with the AI, you can see this interface, and you can type your questions to be analyzed with our web-based evidence. And for example, we want to see the correlation between stroke and periodontal disease. And once you click analyze with AI and literature, and this is the answer of our the previous question. And then here is the quantitative summary based on our results, and you can see the co-occurrence also as well as the prevalence of our study. And then this is the scientific literature with the real citation. And then here is the conclusion and the real references from PubMed that you can access through this link of the citation. And that's all from our presentation. Thank you for your attention.